Hi everyone, this is Professor Nicholson lecturing on describe pharmacologic agents that enhance nutrition. Please review the following subcompetencies on your own. Anemia is a condition where the blood has a lower than normal number of red blood cells, also known as erythrocytes, or has a lower than normal number of hemoglobin. This results in reduced oxygen transport throughout the body. This can lead to fatigue, weakness, and other symptoms due to the body not getting enough oxygen. Red blood cells are cells that contain hemoglobin, as I will describe in a moment. The red color is due to the protein that binds to oxygen. Hemoglobin is a complex protein-iron compound in the blood that carries oxygen from the lungs to the body's cells and helps transport carbon dioxide back to the lungs. So, red blood cells are cells, and the hemoglobin is a protein within those cells. Hematocrit, on the other hand, is the ratio of the volume of red blood cells to the total volume of blood. This can be affected by hydration status. The following slide shows the normal lab values for adults in regards to red blood cells, hemoglobin, and hematocrit. You need to know these. Anemia signs and symptoms include fatigue, weakness, dizziness, pallor, tachycardia, shortness of breath, headache, as well as low hemoglobin and hematocrit levels. Types of anemia associated with nutritional deficits. Iron deficiency anemia is the result of inadequate intake of iron for hemoglobin synthesis. It can be caused by bleeding, pregnancy, chronic alcoholism, disorders related to iron malabsorption, and individuals who take aspirins or NSAIDs. Pernicious anemia is the result of the body's inability to properly absorb vitamin B12, which is needed for the development of red blood cells. It can be caused by a lack of intrinsic factor, so that gastric protein that aids in absorption, as well as chronic use of histamine blockers and protein pump inhibitors, as well as Crohn's disease and bowel surgeries. Folic acid deficiency anemia is the result of inadequate intake of folic acid. It can be caused by lack of uncooked vegetables in the diet, alcohol use, pregnancy, as well as liver diseases. Ferrous sulfate. The therapeutic class is that it's an anti-anemic. The pharmacological class is that it's an iron supplement. Indications. It's for prevention and treatment of iron deficiency anemia. In minor cases of iron deficiency anemia, increased intake of iron-rich foods is encouraged, and in severe cases, a blood transfusion may be needed. The routes include PO, IM, and IV, and the action is that it's an essential mineral for hemoglobin synthesis. The following slide shows side effects of ferrous sulfate. You need to know this. This includes constipation, diarrhea, nausea and vomiting, dark, so green or black, stools, abdominal cramping, staining of teeth if given in a liquid form, and tissue irritation if given IV. Nursing implications for ferrous sulfate includes assessment, so checking the lab values as well as acknowledging and understanding the signs and symptoms. Interventions include preventing constipation, providing liquid form with a straw to help prevent that teeth staining, as well as monitoring for side effects. Patient education includes educating the patient on side effects to watch for, as mentioned in the last slide. Letting your patient know that it's best absorbed on an empty stomach, as well as telling them that orange juice, veal, fish, and ascorbic acid enhances absorption of ferrous sulfate, as well as discussing dietary sources for ferrous sulfate. Vitamin B12. The therapeutic class is that it's an anti-anemic, and the pharmacological class is it's a water-soluble vitamin. Indications include prevention and treatment of pernicious anemia, and the route is via IM, so intramuscular, sub-Q, subcutaneous, or PO, by mouth. This is for dietary deficiencies only. Also note that injections are needed in circumstances when the body is not absorbing vitamin B12 adequately. The action of vitamin B12 is that it's an essential vitamin for the formation of red blood cells. Side effects of vitamin B12 include pain at the injection site, hypersensitivity, as well as headaches. Nursing implications of vitamin B12. You should assess the patient's lab values as well as their nutrition status. Interventions include ensuring the vials of vitamin B12 are protected from light, monitoring the injection sites, and ensuring you administer PO forms with food. You should also monitor for any side effects. Patient education includes educating them on the side effects to watch for, as mentioned in the previous slide, as well as making sure they take their PO doses with meals. Know that PO doses are for nutritional deficiencies only. Injections are for malabsorption. Folic acid. The therapeutic class is that it's an anti-anemic. The pharmacological class is that it's a water-soluble vitamin. Indications include prevention and treatment of folic acid deficiency anemia. Routes are by PO, IM, sub-Q, or IV. The action? It's an essential vitamin for the formation and function of red blood cells. Side effects of folic acid include rash, irritability, and fever. Nursing implications of folic acid. Nurses should assess their patients' lab values. Interventions include encouragement of dietary intake and monitoring for the side effects just mentioned. Patient education includes educating the patient on those side effects. Also, letting your patients know the use of antacids can actually reduce absorption of folic acid. Also to note, intake need for folic acid doubles in pregnancy, even prior to conception. Pulse check. The nurse is caring for a patient who is taking ferrous sulfate. What education does the nurse provide for the patient to enhance absorption? The answer here is B. Take it with orange juice. Because why? Orange juice enhances absorption. Disorders of gastric acidity. Gastritis is an inflammation of the protective lining of the stomach. It can be caused by infection, injury, as well as overuse of NSAIDs and alcohol. Gastroesophageal reflux disease, also known as GERD, is considered a chronic condition and can be managed with lifestyle changes, medication, or in some cases, surgery. It is when stomach acid flows back into the esophagus, irritating the lining of the esophagus. It can be caused by increased gastric secretions, pregnancy, loss of esophageal motility, as well as eating large meals. Disorders of gastric acidity continued. Peptic ulcer disease, also known as PUD, involves open sores or ulcers in the lining of the stomach or duodenum, so that first part of the small intestine. This can be caused by an infection of the bacteria H. pylori, as well as long-term use of NSAIDs and aspirin. Also, smoking and alcohol use could contribute. Diagnosis is usually done by endoscopy procedures, so a barium swallow, as well as H. pylori testing. These ulcers can cause pain and other symptoms, such as indigestion, so that feeling bloated, nauseated, or full feeling, pain that worsens on an empty stomach, as well as epigastric pain. Complications could include bleeding, perforation, obstruction, as well as an increased risk of stomach cancer. You need to remember, sudden onset of heartburn may indicate a medical emergency and requires further assessment prior to the diagnosis of a gastric acidity disorder. Antacids. The indication is short-term relief of symptoms related to gastritis, GERD, and PUD. The route is PO, and it's often in liquids or chewable tablets. The action is that it neutralizes pH of stomach acid, it promotes gastric mucosal defense mechanisms, stimulates the production of bicarbonate, and stimulates production of prostaglandins, preventing that activation of the proton pump. Nursing implications of antacids include assessing for signs and symptoms of gastric distress. For interventions, know that antacids are most effective when taken before or 1 to 2 hours after eating or at bedtime. Make sure liquids are shaken before administering to be most effective. And know that antacids may interfere with absorption of other drugs, for example, enteric-coated ones. Also, monitor for any side effects. I do not have it listed on the PowerPoint, but side effects are simply constipation, diarrhea, gas and bloating, as well as nausea and vomiting. Those are the most common. Patient education for antacids includes educating on the side effects, as I just mentioned briefly in the last slide. Also, educate patients that antacids are used to treat symptoms only, and that liquids provide better relief, and it's for occasional and short-term use only, so 2 weeks. Types of antacids. We'll start with calcium salts. An example of this is Tums. Side effects include constipation and kidney stones. It is not recommended for patients with renal failure, as calcium can accumulate to toxic levels. Long duration of using calcium salts can cause an opposite effect, so increased gastric excretion. Moving on to sodium salts. An example of this is Alka-Seltzer. The side effect is usually gastric distension. Sodium salts have a quick onset and short duration. They are not recommended for patients with heart failure, hypertension, or renal failure due to sodium content. Types of antacids continued. Aluminum salts. An example of this is Amphigel. Side effects include constipation. This can be used with magnesium supplements to counteract this side effect. It is easily excreted, so recommended for patients with renal disease. Again, it's easily excreted, so it is recommended for patients with renal disease. Moving on to magnesium salts. An example of this is milk of magnesia. The side effect is typically diarrhea. Know that it is dangerous to use with patients diagnosed with renal failure, as the kidneys cannot excrete that extra magnesium. Again, it's dangerous to use with patients diagnosed with renal failure, as the kidneys cannot excrete that extra magnesium. H2 receptor antagonists. Indication: it's for prevention and treatment of gastric and duodenal ulcers, gastritis, and GERD. The route is dependent on the drug. Actions: it suppresses acid by blocking histamine at H2 receptors. Side effects are rare, except in patients with renal or hepatic impairment. It increases, of course. Examples include cimetidine, ranitidine, nizatidine, and famotidine. Nursing implications of H2 receptor antagonists. Assessment include watching for signs and symptoms of gastric distress. Interventions include that they are most effective when taken after meals or at bedtime. Also, making sure your patients avoid taking the H2 receptor antagonists with antacids to prevent interference with that absorption. Also, make sure you monitor for side effects. I did not list them on this slide, but common ones could include diarrhea or constipation, headache, dizziness, fatigue, as well as nausea. Patient education includes educating patients on those side effects, as well as ensuring they only take them short-term or occasional, so 2 weeks if short-term use. Proton pump inhibitors. Indication is prevention and treatment of gastric and duodenal ulcers, gastritis, and GERD. This is the drug of choice for treatment of ulcers caused by H. pylori, used in conjunction with antibiotics. The route is by mouth, and actions include that it binds to enzymes that act like a pump to release gastric acid. Side effects include headaches, and long-term use is associated with osteoporosis. Examples include omeprazole, esomeprazole, lansoprazole, and pantoprazole. Nursing implications of proton pump inhibitors. Assessment includes watching for signs and symptoms of gastric distress. Interventions include that it should be taken before the first meal of the day. It may also be used with antacids. Also know that it may increase bleeding if used with warfarin. Calcium supplementation is recommended in long-term use, as well as making sure you monitor for side effects of proton pump inhibitors in your patients. Patient education includes educating patients on those side effects to watch for. Like mentioned in the last slide, it's typically headaches, as well as making sure patients avoid NSAIDs, alcohol, and irritating foods. So, if you have a patient taking omeprazole, it is best for them to take it 30 minutes prior to breakfast for the best absorption. Mucosal protectants are used to protect the lining of the stomach. It binds to the base of ulcers and erosions, forming a protective barrier. Most common mucosal protectants include sucralfate and misoprostol. The mucosal protectant, sucralfate. The therapeutic class is that it's an anti-ulcer agent. The pharmacological class is that it's a GI protectant. Indications are for stress ulcers and PUD. The route is PO. Side effects include constipation, dry mouth, and nausea. Nursing implications include that it may impair absorption of other drugs, so give other medications 2 hours prior. Also, ensure it is given on an empty stomach before meals and at bedtime. The mucosal protectant, misoprostol. The therapeutic class is that it's an anti-ulcer agent. The pharmacological class is that it's a prostaglandin. Indications is that it's for ulcers in patients with prolonged NSAID or aspirin use. The route is PO. Side effects include abdominal cramps and diarrhea. Nursing implications is that it's contraindicated in pregnancy. In pregnancy, misoprostol is only given for the induction of labor or for postpartum hemorrhage. We discuss how nausea and vomiting is a side effect on many medications. This chart shows how vomiting occurs. To review, nausea is an unpleasant feeling that often precedes vomiting, and vomiting, also known as emesis, is the forcible emptying of gastric contents and occasionally intestinal contents. Antiemetic medications are used to relieve nausea and vomiting. Note, CTZ stands for chemoreceptor trigger zone. It's a specific area in the brain located in the medulla oblongata that plays a crucial role in initiating the vomiting reflex. Antiemetics and anti-nausea drugs. The type of medication used is based on nausea and vomiting. The mechanism of action depends on the type of medication, but most work by blocking the specific pathway to the vomiting center. They are most effective when given prior to nausea and vomiting. Routes include IV, IM, rectal, transdermal, and PO. So, if I was to ask you a question regarding the best route to give a PRN order, so a when necessary order, to an actively vomiting patient, the answer would not be by mouth. If anything, rectally is the best option, especially if the patient does not have an IV. This would be the quickest route. You need to know that. Nursing implications of antiemetics and anti-nausea drugs include assessment, so assessing for the severity of symptoms, the risk for dehydration and electrolyte disturbances, as well as implementing diet as appropriate. Interventions include providing comfort measures, providing oral care, as well as monitoring for side effects. Side effects are not listed on this slide, but know that they can vary widely depending on the specific drug. Common ones include fatigue, drowsiness, headache, and constipation. Regarding patient education on antiemetics and anti-nausea drugs, educate the patient on those side effects to watch for. Have patients change positions slowly and make sure they avoid alcohol. Types of antiemetics and anti-nausea drugs. First, we'll start with antihistamines. An example is meclizine. Side effects include sedation, dizziness, and dry mouth. These block the H1 receptors of the inner ear. A reminder, H1 receptors mediate the effects of histamine, a biogenic amine that acts as a neurotransmitter and immune modulator. Antihistamines are most commonly used for motion sickness. They are best if given before the onset of symptoms. They are available over the counter. Next, we will talk about antidopaminergic drugs. An example is prochlorperazine. Side effects include drowsiness, constipation, dry mouth, blurred vision, muscle rigidity, and tremors. These drugs block dopamine receptors. Dopamine receptors play a wide range of functions, including movement, motivation, pleasure, and cognitive processes like memory and attention. Antidopaminergic drugs are most commonly used for chemotherapy and postoperative patients. You need to know that if your patient is experiencing any side effects, no matter the drug, you need to notify the health provider to evaluate. Types of antiemetic and anti-nausea drugs continued. We'll start with prokinetics. An example is metoclopramide. Side effects include drowsiness and restlessness. Prokinetics stimulate peristalsis in the GI tract, so it improves GI motility by increasing the frequency or strength of contractions in the stomach and intestines without disrupting their rhythm. They are most commonly used for nausea and vomiting related to GI issues. Next, we will discuss serotonin antagonists. An example is ondansetron. Side effects include headache and dizziness. Serotonin antagonists block serotonin receptors in the GI tract. They also block the CTZ, so that chemoreceptor trigger zone, as well as the vomiting center. Just a reminder, serotonin receptors are found in both the brain and the peripheral nervous system, and regulate mood, sleep, appetite, and other functions. Pulse check. Let's say an older adult calls triage and reports sudden heartburn and is asking what is the best over-the-counter medication to take. What is the most appropriate nursing action? What would you recommend? Absolutely nothing. You would direct them to the emergency room.